Between the years 2000 and 2035, the number of households of people aged 65 and over is projected to increase from 22% to 39%. Research has shown that 85% of seniors and 91% of caregivers desire a specialized emergency care experience. St. Mary Mercy, a member of St. Joseph Mercy Health System, is the first hospital in the state of Michigan with an emergency center exclusively dedicated to meet the needs of those patients 65 and older. Let's hear from some of our neighborhood professionals as they enlighten us on the details of this progressively forward-thinking program.
The senior ER is a concept that really started with us at our Silver Spring Hospital about 2.5 years ago. And it's the first in the country that we're aware of. And the concept is there are needs that people who advance in age have that are different than people in the middle of their life or at the beginning of their life. And oftentimes the emergency care, that very good emergency care that was delivered across the country, didn't focus in on those special needs. And if we do focus on it, patients do a lot better. So that's really kind of the basic idea behind it.
Well, the Senior Emergency Center is specifically designed for patients that are age 65 years age or older. And why it's designed is to take that patient out of that chaotic environment that's in the emergency center, which really affects a patient as they get older because of the noise that's there, the telephones that are ringing. So what we have done here at St. Mary Mercy Hospital is that we've designed an area which is just a few steps away from the main corridor of the emergency center that's nested right in a corner, that we've been able to design 6 private rooms for these patients.
St. Mary Mercy's Senior Emergency Room Center has been open since July 14th. It's a specialized area, an environment for seniors 65 and older who meet a certain criteria. The environment is very conducive to their well-being. It's quiet. It's got special visual enhancement, hearing enhancement, nursing care, social work. We're very patient-centered back here and interdisciplinary.
The way it started, though, was our president of the hospital in Silver Spring, Maryland, called Holy Cross Hospital, experienced with his own mother an emergency visit, not at our hospital, but at a nearby hospital in Maryland, a very good hospital. And he was really distressed at some of the things that happened in her care. It was medically competent care, but the communication wasn't good. There wasn't a good plan for her discharge. It was confusing. People were not communicating with her in a way that she could understand. And so he came back and challenged his own team to improve their care. The idea really took fire with those of us in Michigan, that we thought this is something we should do. So that's really how we started doing it. And we've been able to really improve it even from the Silver Spring model, and they have adopted some of the improvements by working with a national consultant, a published geriatrician, Dr. Bill Thomas, has helped us to develop it even further. So what you see today in Livonia and at our other Eastern Michigan hospitals is this continuously improving concept. But the idea is understanding the way seniors best receive care and how to understand their needs best. The area probably that has been the most impactful has been in training. All of the registered nurses and the patient care assistants have had specialized training.
Even though as many years that you've had of experience, and I've been a nurse for 35 years, it hasn't really prepared you for caring for the older adult. So we've taken this specialized training for us to be able to learn as we age of all the different changes that one adult goes through. And the other thing that we've done, we've also partnered with the Institute for Geriatric Nursing at the New York University, and many of us are taking leadership training so that we can learn other ways to take care of older patients. Just for example, a young person comes in and they might have an infection or they're going into shock, they're going to increase their heart rate. They're going to increase their respiratory rate. But an older person may not show that. So we have to be all aware of these subtle signs and symptoms that an older person may present with, and their presentation might just be acute changes in mental status changes, and that is our trigger, that there's an underlying infectious process, something possibly neurological going on, so we can intervene with these patients in a prompt manner.
We developed a number of standards around how we wanted the senior emergency room experience to be. So that involves preparation of the environment through the facility, so we have standards for making it more senior friendly. And we have standards around developing culture, around education, around communication, and around handoffs or preparing people for the next phase of their care, whether that's a discharge to their home or to another facility or here for an inpatient stay.
When a patient arrives to our emergency center that's 65 years of age or greater, or basically any patient that comes to our emergency center, whether they're coming in by ambulance or they're walking in, they're triage, which is called to sort. So we look at these patients and what they're coming in with, and if they have a deficit, what we call in their primary survey, they have an urgent matter in their airway, their breathing, their circulation, or they're having a stroke or an active heart attack, these patients are going to stay in the main emergency center. Patients that are less acute will move back into the 6-bed area so that all these additional screenings can occur.
Part of my role as a social worker in the senior center is to do a psychosocial assessment based on the initial triage when the patient comes in. We're able to identify levels of depression, nutrition, they're at risk for falls, isolation, being home alone, possibly some neglect or abuse, whether intended or not. So the role of the social worker that I play is to assess that particular need and prior to the patient leaving, provide services that would enhance their ability to maintain their quality of life, return home in a safe environment.
We do a whole assessment on their activities of daily living. Can they walk? Can they bathe? Can they clothe themselves? And this opens up a whole information network that we're finding out that seniors need. And Kathy, our social worker, is able to provide these types of services.
For example, if somebody were coming in falling quite frequently, we could order them a home care, which would be beyond balance. So when they do go home, we send a nurse and a therapist, possibly an occupational therapist, social worker in to see them in their home and work with them at home to increase their safety, i.e. decrease their need to come back to the emergency room senior center. And people like that, they don't want to come here. They don't want to go to a nursing home. They want to go back home. And we see a lot of caregiver strain as well, especially with our seniors aging in place, if you will, and wanting to stay independent where their family members are just upset. They don't know what to do. The patient doesn't want to be a burden to their family. So we can help the caregivers as well by providing them with adult daycare, grief support, home delivered meals, low-cost medication, and a lot of our local pharmacies actually deliver medications to patients in their home. And there's also visiting physicians who, when a patient becomes homebound, they can actually get a team of medical staff to go and see them in their home environment, which is wonderful for the patient and the family.
When you come into this area, it's very calm, it's very serene. There's nice soft colors that are in here. We have lights that can be dimmed for this population because as we age, our visual acuity changes. And also our hearing also changes too, and that's why we needed to have our senior population try to be removed from that chaos environment. We've also designed the area too with airflow pressure reducing mattresses for our seniors, and whenever you do anything for a patient that's older, anything specific design or enhancements that you do, everybody benefits.
We make sure that all the materials people have to read are of a font or the size of the print is big enough that it can be read if you have some visual acuity problems, which oftentimes happens to us as we age. We have ways, if you're having difficulty hearing, we have enhancements for hearing devices that we can use so that you can hear us and communicate and people don't have to raise their voice.
If our patients are not ill, so ill that they have to be on a cart, we actually have reclining chairs, and they really like that, to be in a reclining chair, because it feels like they're not as sick. And we really encourage, when the patients here in the Senior Emergency Center, we want to make sure that they're getting up, they're moving, because we do know that deconditioning happens right away, and so we want to make sure that these patients are moving around.
There are things about reducing falls, which is a concern in older people, especially when they're in an environment they aren't familiar with. So we've developed supports and different ways for them to move about in that space with lower risk of falling. The floors have a certain type of texture that doesn't have glare, so people don't mistake stepping. And overall, the whole environment is just much quieter and calmer than in the main hustle and bustle of an active emergency department where all kinds of different care is being delivered.
We are very fortunate the way it was designed that we have windows that are, almost every room has a window, and it supplies them with that natural lighting, which is very important because as seasons change and we don't get the sunlight, this is able to give them that sunlight that they need.
Everybody that leaves a senior ER is followed up by me with a follow-up phone call, and I'm getting a lot of feedback for patients saying that during their stay here they felt it was different than a prior visit in terms of the special attention, the environment, the care, and mostly the time taken to get to know them as a person, because we know that it's not just you're coming in for a heart attack or a stomach upset or a fall. You're a lot more than that. And seniors really do appreciate that time spent, because a lot of times they're not only not listened to, they're not heard in the way they'd like to be.
Because of the growing population that we have, and age 65 years of age or greater comprises 12.5% of the population. And in most hospitals, most of your patients are elderly patients. And for us working with these patients and us being continuous learners, we're able to respond to these older adults. And they teach us every day how to care for them. And so as we look at it here in our Senior Emergency Center and throughout all of our ER, is that we're able to provide these patients a safe outlook, a safe watch for our present and future seniors to come.
It's been very well received. People are very enthusiastic. The people we've been able to deliver care to under this model, which we've been doing since July, are giving us very positive feedback.
Well, hello and welcome to our grand opening of our Senior Emergency Department at St. Mary Mercy Hospital. I'm Dave Spivey, President and CEO of St. Mary Mercy. As the first senior ER in the state of Michigan and the only in Wayne County, we're also the first of what will be 8 St. Joseph Mercy Health System locations to open this new service. It's been extremely well received by our community and by patients, family members, and our caregivers here at the hospital. We first opened on July 14th after renovating a kind of segregated area of our emergency center. It's specifically designed to meet the needs of seniors 65 and over. The model of care includes not only the traditional care one receives in an emergency room, but it also includes some physical changes to the plant to make it a warm and friendly and comforting place for seniors to be. And our physicians, our nurses, our social workers, and our techs, they're all geriatric trained to offer a unique care experience in this setting to our seniors in our communities. At St. Mary, we're not only proud to be the first senior ER in Michigan, but most importantly honored to offer this unique and specialized care to a well-respected population who very much deserve it.
In the early days of our congregation, Blessed Mary Angela and the Felician Sisters ministered to women, children, and the elderly in the ghettos of Poland. The Senior Emergency Center follows this vision of Blessed Mary Angela to be of service to the seniors in our community. As we open this new service, we remember and give thanks for our seniors who have given so much to our communities and to their individual families. When they were young, they gave of themselves, and many continue to do so, but as they age, they need our assistance. The aspect of connectedness is at the heart of the care model that will be provided in the Senior Emergency Center. The staff have been specially called to this ministry to provide holistic care, body, mind, and spirit, to both the patient and their caregiver to improve the quality of their life. And so as we gather on this grand opening of this service, we pray for the elderly. Lord, let your hand of healing and protection be upon them. Ease any fears or anxieties they may be experiencing. Let them feel your comfort and the comfort of those around them. When they are afraid, give them courage and strength. When they feel alone, send them someone who can listen and be present to them. When they feel confused, give them reassurance and direction. And when they are in pain, provide them with caregivers who can ease their suffering. We ask this in your name. Amen.
As Dave stated, we opened our senior ER July 14th. We were first in the state of Michigan as well for Trinity Health, and we're very proud of this. We're currently averaging about 16 patients a day. Not all our patients are eligible for the senior emergency department. Those that are more critical are seen in our main emergency department. But each senior receives the same level of care and the assessments depending on where they're located in the emergency department.
This has been a dream come true. This is an awesome opportunity that we are doing, that we can show that caring difference for the population that we're serving. As we know, America's not getting any younger. We're all getting older. And as we age, we're faced with many complex medical, physical, and social needs that are often not captured in an emergency center. So it makes sense that senior ERs are developed because we are the front door where every patient comes in. We knew within the first few hours this was sacred, what we were doing. We found out during a nutritional assessment, someone was not being able to eat real well. So she was able to secure within 24 hours Meals on Wheels. And when Kathy called her the next day, she said, "God bless you. I can now eat a hot meal." As we look at what we're doing, we look at the seniors. They're our teachers too, and we're their students, and we're learning every single day from them as we continue on this on a daily basis. And we've been open now for almost 5 months, and we've impacted so many lives as they've impacted and enriched our lives. And now, as we look at it, we're paving the way for future seniors to come. And we're paving our way, right? We're not getting any younger. So it's a privilege and an honor, just like every staff member says in that Senior Emergency Center. We're humbled and we're grateful to be there. And as Sister Mary Angela said, who's the foundress of the Felician Sisters, who built this beautiful area, this 5-mile radius, her mission from God was to respond to the needs of the times. And that's exactly what we're doing.
As you can see, we've got a couple of good people really associated with this project, and when you put people like Karen and Michelle in charge, good things happen. Thank you so very much for coming and celebrating the opening of our senior ER here at St. Mary Mercy Hospital.
With multiple senior emergency rooms operating throughout Michigan, the St. Joseph Mercy Health System should be commended for their pioneering vision in senior care efforts. I'm Marty Moore. Thank you for watching.